All right, Mike. Thank you for joining us in the Jorie Podcast Tech Talk. So we appreciate you coming in and visiting, thinking about what we're doing. So start us off. Can you tell us a little bit about you and what you're doing with Heritage Health?
Sure. Yeah. So I run a federally qualified health center. We're community health centers. We do
Very
medical,
vital. Very
medical,
vital.
dental, behavioral health, substance use treatment, pharmacy,
Wow.
all of the things. Just really trying to enter the space around primary care. I mean, we take care of everybody, but we want to do primary care different, like really look at the preventive side
Sure.
of doing things. So we've created what we call a center for healthy living, where
Nice.
everything's in one spot. And then, really looking at how do we leverage technology to help us with the staffing and, all of the things we have to do in healthcare right now that we're all struggling with. So
Sure.
It's really exciting to see companies like yours out here, finding ways to partner with us in
Yeah.
the healthcare side to help us do the work. So
Sure.
It's great.
Yeah. That's what our passion is
Yeah.
really with. So tell us a little bit about federally qualified centers versus non. What's the
Yeah.
difference in that?
Honestly, I love it when nobody even knows the difference,
Yeah.
right? So
Yeah.
we should provide healthcare so great that everybody wants to go to a health
Yes.
center.
Yes.
But at the end of the day, we're a nonprofit. We're focused on taking care of just everybody in the community. So if
Sure.
you don't have insurance, we have sliding fee. We can help you with your medications so that they're affordable. We're really just geared to taking care of everybody that comes through the door
Yeah.
versus kind of a private practice where you can select sort of
Right,
what patients
right.
come in the door. But it's a great model.
Yeah.
I love it.
Well, it's vital, and it's vital especially for the communities you're in, right?
Right.
I mean, because what we've seen is some of the systems like yours that are in place, if they're not there, people don't have health care, period. End of story.
Absolutely. And I know you're from Texas. I mean, in rural communities, oftentimes the community health center is the only space. I have
Yes.
a good friend in Chalice, Idaho, and they are the ambulance service. They are the healthcare provider for the community. And, with all of the challenges out there with funding, like we have to find a way to make this work.
Sure.
But also you're never going to have the staffing at my rural health centers that I might in a more urban site. And,
Right.
and even then it's challenging. And so
Sure.
we have to find ways to leverage these new tools to come in and just allow us to provide incredible healthcare with the people and the staffing that we have in our
Yeah.
spaces.
Well, and that's an interesting point because when we first came to market, especially in the rural healthcare market, there was a little bit of a concern of, wait, you're AI,
Yeah.
we're going to lose our jobs and all that. And, it took a bit for us. And now we're even doing some things where we're actually trying to get certifications for, especially for rural hospital staff that are still there, because that's not our goal. Our goal isn't to replace staff. It's to enhance what they're doing. They're over, they have way too much to do as it is right now.
Yep.
So we want to just make it easier for them. So yeah, that's a very good point. Do you see that? I know that in a lot of the rural markets, staffing isn't easy. Have you experienced that?
100%. It's just healthcare is difficult. And then we had a period of time where we ran people out of healthcare.
Yeah.
And then trying to get young kids excited about healthcare again. I think when I was a kid, doctors had this prestige. It was cool.
Yeah.
And I don't know that people feel that way. I think there's
Agreed.
always that side of it, but I think the business side of medicine really pulled away some of those components where I think AI honestly can help us bring back the human side of healthcare,
Agreed.
right? Because all the things that came in, all the charting and documentation and billing and all that, you used to bring a chicken in and pay for your visit, right? That's a really easy thing, and we didn't have to code it. But now we have so many rules. I think
Sure.
it's taken the human energy and put it into that space instead of this face-to-face conversation about your healthcare and how we can partner to help you live a better life.
Yeah.
I truly think that's how AI can save the healthcare system.
I agree. So as you see, we talked about it earlier, as you see AI come into market and you see all the there is a lot of buzz out there. Can you kind of talk specifically, and I know you just mentioned it, but can you give a little bit more breadth of how you think someone like Jorie could come in and help your hospital system?
Yeah. So across the board, it's just really looking at at the repeatable tasks that we don't have to have humans do. Right. I mean, so I look at billing, I look at coding, you look at just the administrative side of the house. I mean, there's so many things that we can do well.
Sure.
But there's also like those really cool components. So I use AI to create music and art. And I think there's ways to do like outreach to patients for your treatment plans and like connecting with people in the care management space.
Yes.
Just to tell those stories and really connect with people, because I think it can be healing. And I think there's this epidemic of loneliness, and not that you want your AI chatbot to be your partner, but you also, you can have somebody to connect with and really work through things. And then, hopefully that's pushing you out into the space to go live in the human space.
Yeah, right.
Yeah.
Well, it is interesting that you say that, because what we have found that the revenue cycle teams that really attach themselves to this, they do feel like, they want to name our bots, right? And so you just raised a great point. There is an attachment there that they feel like they're not doing it alone. It's not all on them. So
it's really fun to see it come into space. I checked into the hotel and I got a text from Rose. And Rose was like, "How can I help you today?" And I'm like, "Well, can I get in my room early?" And she's like, "Well, too bad it's not ready." But like, it's just like I'm having these interactions, the way I use ChatGPT, right? Like I'm talking to it as I'm driving and like helping me process things. But there's a space there. I think when we were all kids and watched Star Trek and, Iron Man and all these things, like this stuff is coming to fruition, and we have these tools. I think for me, it's like, how are we going to use it? Are we going to use it to make the world better? Or, there's that challenge of like the people that aren't.
That's scary.
But we need to win. Like we need to really leverage this tool and just do something incredible with these tools. Because it matters. It really matters. At the end of the day, if I can, like through my healthcare and leadership and music and art, like if I can help someone feel better about themselves today, and they get through the day with a smile instead of another choice where they give up hope, that's a win. And I think, our healthcare workers and everything else, like they don't love their jobs when all you're doing is data entry and rocking through things. Like, but we always have to share, like this actually helps patient care on the other side. But the more we can get people interacting with each other again, I think we solve a lot of other problems too.
Agreed. So we'll close on this note, but I do want to get your thoughts. So I mentioned it earlier, but we're trying to work with universities to get a certification for revenue cycle employees to get certified to utilize and function alongside AI. What do you think about that offering? Do you think that'll be beneficial?
Yes. That's an incredible idea. Because I think these tools are here. So we need to learn how to use them, and we need to not have people be afraid of them. It's weird to say that like an AI bot can be a partner, but it absolutely can be a partner to help you just do your job better. And like we have seen in our AI scribing, like our notes are better. Our providers are going home early. The things are happening that we've been working toward for years. We're seeing it, and people actually love their jobs again, because they get to just talk to people and do the stuff they were trained to do. So I'm really excited about the future, and I'm excited, to learn more about you guys.
That's great.
And then just see all of these companies that come in and partner with us. Like, please partner. Like help us. We'll help build tools out too. And then don't forget about the community health centers, because we usually get this technology like 10 years later. And I think we're the great proving grounds for a lot of these tools.
True. Well, our passion and desire is to help support people like you who are out there doing the work. So we just want to tell you from Jorie's perspective, we appreciate what you're doing. We appreciate you being a CEO of a healthcare organization that can provide all the services you are. No telling how many people's lives you're touching. So we're super grateful for that, and we appreciate you.
Thank you very much. This has been really fun.
Awesome.
Thank you.
Thank you, Mike.